Hey everybody, this is Susan, and this is Sunday, July 24th. It's a beautiful day outside. Unfortunately, because of the medicine I take, I can't be outside in it. But I wanted to give you all a little information today, just to make sure that, my sisters out there are taking care of themselves, and you know what to look for as far as the warning signs that you may have the early stages of heart disease, you might be in the early stages of heart failure, stuff like that. I pulled down some information from the American Heart Association, and it is a wonderful resource to go and check out these things. Some things that you may not notice right away, but you might have some chest discomfort or pain, and this discomfort or pain can feel like a tight ache or pressure or fullness or squeezing in the center of your chest that lasts more than a few minutes, and it may come and it may go. And some women might just say, well, I just might not have feel good, or I might have pulled a muscle from exercising or something like that, instead of trying to go seek treatment. And you might have upper body pain that might spread from your chest, your shoulders, your arm, your neck, and your teeth or your jaw. Now I developed jaw pain, and I didn't understand what that was coming from. It was a radiating pain that came from my neck and all the way up to my jaw, especially when I was chewing something, pretty hearty, like bread or apples or something like that, and I kind of dismissed that. You can have stomach pain in your lower abdomen or lower back. Of course, the shortness of breath, anxiety. I suffer from anxiety as well, because I have a panic disorder. But I've had that panic disorder since I was a young girl, and I'm talking about like 7 years old. I started having panic attacks then, But of course, like I said before, they're not looking for heart disease in a kid that was 18 years old. So I'm looking back over my life and the signs and the symptoms that I missed, as being heart disease. And there's really no telling how long this thing was brewing in my body, and of course I was helping it right along with the drinking and the smoking and, the partying, and just being really abusive to my body. You can also have lightheadedness, sweating when you just break out profusely. Now, if you're not over 45 or going through menopause and you're having your own personal summer and you don't know why, it could be that you're having a heart attack, And then, of course, there's the nausea and the vomiting, which I had. I say this to please, stress that women, especially because our signs and symptoms of heart distress for us are different, and men, that have these sudden cardiac events, there's something that was a precursor for it, where he's got the pain in the arm or something like that. He's grabbing his arm and then he, pretty much keels over. But, with a woman, it could come in various masked things where we don't know exactly what to look for. So I say this to, please, do some research. And, if you have to, and when you go to the doctor, have a checklist of some symptoms and signs that you didn't think were relevant but could actually be relevant, because they may want to do an EKG, a chest x-ray. There's a whole host of examinations that a doctor can do for you to see if you're in the early stages of heart failure and what you can do to try to slow its progression down. And again, this is just, my little spiel today. I won't keep you all for long, but I just wanted to get that information out there to you. And again, this is Susan. And like I said before, if you want to hit me up in the email, it's Susan_Washington@rocketmail.com. Or if you want to check out my blog, it's thefaceofheartfailure.blogspot.com. Or, like I said, if you really want to talk about it, you can call me at 941-567-4470. I'm here to listen to you day or night. And again, this is the face of heart failure. And you all be blessed and have a great day.